Have you ever wondered if there's more to healthcare than pills and surgery? Welcome to the intriguing realm of complementary medicine, a world that stretches beyond the confines of conventional medical practices. Complementary medicine, also known as alternative or integrative medicine, has a rich and diverse history that spans thousands of years. It is rooted in ancient practices, with civilizations across the globe having their own unique methods and remedies. From the Ayurvedic traditions of India to the herbal remedies of Native Americans, these practices have stood the test of time, offering holistic healing approaches that consider the mind, body, and spirit. In recent years, we've seen a surge in the popularity of complementary medicine. A growing number of people are exploring these alternative methods, seeking treatments that align with their personal beliefs, values, and preferences. This shift in mindset reflects a desire for more personalized, patient-centered care, which is at the heart of complementary medicine. But how does complementary medicine differ from traditional medicine? Well, that's a question with many layers. Traditional medicine, also known as Western or allopathic medicine, tends to focus more on the physical symptoms of illness. It often relies on pharmaceuticals, surgery, and other medical procedures to treat diseases. Complementary medicine, on the other hand, approaches health from a holistic perspective. It emphasizes prevention and health promotion rather than just disease treatment. Complementary practitioners often use natural and less invasive methods, such as acupuncture, massage, yoga, and dietary changes. They believe that health is about more than just the absence of disease. It's about achieving a state of complete physical, mental, and social well-being. As we navigate through this series, we'll be exploring the many facets of complementary medicine, from the philosophical foundations to the clinical applications. We'll examine how these practices can be used alongside conventional medicine, providing a more comprehensive approach to healthcare. So, fasten your seatbelts and prepare for a journey into the unknown. As we delve deeper, we will discover the fascinating universe of complementary medicine. In order to understand the difference, let's first take a peek at what constitutes traditional medicine. It is a vast realm with many intricacies, but we'll try to distill it down to its core principles. Traditional medicine, as we know it, is based on the diagnosis, treatment, and prevention of diseases. It's a system that has been developed and refined over centuries, with its roots reaching back to the times when human civilization first grappled with the mysteries of the human body and its ailments. The principles of traditional medicine are grounded in the scientific method. It's a method that starts with observation and leads to hypothesis, testing, and finally, conclusions. For instance, when a new disease emerges, traditional medicine uses scientific investigation to understand the cause, symptoms, and potential treatments. This rigorous process ensures that every diagnosis is based on a well-established body of knowledge. Every treatment prescribed has been rigorously tested, and every preventive measure suggested has been proven effective. It's a system that values evidence above all else, with the goal of ensuring the best possible outcome for the patient. Traditional medicine also focuses on the prevention of diseases. It seeks to understand the factors that lead to illness and strives to mitigate them. This could be through recommending lifestyle changes, vaccinations, or other preventive measures. The aim is not just to treat the sick, but to keep people healthy. At the heart of traditional medicine is a deep respect for the scientific process. It's a process that seeks to understand the world in the most objective way possible, using carefully controlled experiments and rigorous testing to ensure that the treatments provided are safe and effective. So, traditional medicine is not just about treating symptoms or diseases. It's about understanding the human body, the causes of disease, and the most effective ways to maintain health. It's about applying the scientific method to healthcare, ensuring that every treatment is backed by solid evidence. Traditional medicine, with its scientific backing, has been the cornerstone of healthcare for centuries. Now, imagine a world where health and wellness go beyond just treating symptoms. This is the very essence of complementary medicine. It's a world that doesn't just focus on a single ailment or disease, but takes a holistic view of the individual. Complementary medicine is built on the philosophy that health is more than just the absence of disease. It's about achieving a state of complete physical, mental, and social well-being. This philosophy is rooted in the belief that the body, mind, and spirit are interconnected and cannot be treated in isolation. The holistic approach of complementary medicine is all about balance. It's about maintaining a delicate equilibrium between different aspects of our health. This includes a balance between our physical health and mental health, between our body and our environment, and between our lifestyle and our well-being. Complementary medicine also highlights the importance of self-healing. It recognizes that our bodies have an inherent ability to heal. This healing power is often suppressed due to stress, unhealthy lifestyle, and other factors. Complementary medicine aims to tap into this dormant potential and promote natural healing. It encourages practices that enhance the body's natural defenses, such as proper nutrition, regular exercise, adequate sleep, and stress management. But it's not just about the physical. Complementary medicine also emphasizes the role of the mind and spirit in health. It advocates for practices like meditation and mindfulness that nurture our mental and emotional well-being. It acknowledges that our thoughts and emotions can have a profound impact on our health. Complementary medicine is a world where health is seen as a journey, not a destination. It's a world where prevention is just as important as cure, and where the focus is on enhancing the quality of life rather than merely prolonging it. Complementary medicine seeks to harmonize the body, mind, and spirit for optimal health. It's a world where health is more than just being free from illness. It's about achieving a state of complete well-being. It's a world that recognizes the unique individuality of each person and tailors the treatment accordingly. It's a world where health is a shared responsibility between the individual and the healthcare provider. Two different approaches, but how do they really compare? Imagine you're standing at a crossroads with signs pointing in two different directions. One sign reads traditional medicine, the other complementary medicine. Each path represents a unique approach to healing and wellness. How do you choose? Let's delve deeper into these two worlds and see how they stack up against each other. On the one hand, traditional medicine, also known as conventional or Western medicine, is the mainstay of modern healthcare. It's grounded in rigorous scientific research, clinical trials, and evidence-based practices. Its strengths lie in its ability to diagnose, treat, and prevent diseases. Think of surgeries, pharmaceutical drugs, radiation, and other treatments that directly target the disease. But this approach is not without its drawbacks. It often focuses on the disease rather than the person, leading to a fragmented view of health. Additionally, the side effects of some treatments can be severe, and the cost of care can be high. On the other hand, complementary medicine takes a holistic approach, treating the whole person, mind, body, and spirit. It emphasizes prevention and uses natural, less invasive methods, such as herbal remedies, acupuncture, yoga, and meditation. The strength of complementary medicine lies in its ability to enhance overall well-being, manage chronic conditions, and alleviate stress and pain. However, it's important to note that complementary medicine also has its limitations. Some methods lack rigorous scientific validation, and outcomes can vary widely from person to person. Plus, it may not be effective in emergency or acute situations. Now imagine if these two worlds could seamlessly integrate. This is where integrative medicine comes into play, combining the best of both worlds for a comprehensive healthcare approach. Here, traditional medicine provides the strong backbone of diagnosis and acute treatment, while complementary medicine brings in the holistic, preventive aspect. This fusion can lead to a more personalized healthcare experience. It offers a broader array of options for treatment and prevention. It encourages self-care and empowers individuals to take an active role in their health. But like any fusion, it requires a delicate balance. It's crucial to ensure that the complementary methods used are safe and effective, and that they don't interfere with the traditional treatments. It also requires open communication between healthcare providers and patients about the methods being used. So, as we stand at this crossroads, we see that each path, traditional and complementary medicine, has its own strengths and weaknesses. Neither is perfect on its own, but together, they have the potential to redefine healthcare, making it more holistic, personalized, and effective. Every coin has two sides, and so does our healthcare system. But how does this work in real life, you might wonder? Well, let's delve into some real-life examples and case studies where complementary medicine has played a significant role in healing and recovery. Consider the story of Lisa, a woman in her mid-30s who struggled with chronic migraines. Traditional medicine provided temporary relief, but the migraines always returned. Frustrated, Lisa turned to acupuncture, a form of complementary medicine that uses thin needles inserted into the body at specific points. After several acupuncture sessions, Lisa noticed a significant reduction in both the frequency and intensity of her migraines. Today, she continues her acupuncture sessions as a preventive measure and enjoys a better quality of life than she ever did on traditional medication alone. Then there's the case of Mark, a former athlete who suffered from chronic knee pain after a career-ending injury. Painkillers and physiotherapy, the standard treatment modalities, did little to improve his condition. Mark then sought out chiropractic care, a form of complementary medicine that involves manual adjustment or manipulation of the spine. Remarkably, after a few months of regular chiropractic sessions, Mark's knee pain decreased drastically. He was even able to return to light physical activity, something he thought he'd never do again. Let's also talk about a group study conducted in a hospital setting. Patients undergoing major surgeries were introduced to guided imagery, a complementary medicine technique that uses mental images to help the body heal. The patients who used guided imagery reported less post-operative pain and anxiety compared to those who didn't. They also required fewer pain medications and had shorter hospital stays. This study highlighted how integrating complementary medicine into traditional healthcare systems can significantly improve patient outcomes. And finally, take the example of a community health clinic that incorporated yoga and meditation into their treatment programs for patients with mental health issues. The patients who participated in these complementary medicine practices showed marked improvements in their symptoms of depression and anxiety. They also reported better sleep quality and overall well-being. These are not isolated instances. There are countless stories worldwide of people turning to complementary medicine and experiencing incredible results. Whether it's acupuncture for migraines, chiropractic care for chronic pain, guided imagery for surgical recovery, or yoga and meditation for mental health, complementary medicine has proven to be a valuable tool in the healthcare arsenal. It's important to note, though, that complementary medicine is not a substitute for traditional medicine. Instead, it complements and enhances conventional treatments, offering a more holistic approach to health and well-being. The integration of complementary medicine into traditional healthcare systems has the potential to improve patient care, reduce healthcare costs, and ultimately lead to healthier, happier lives. These stories are a testament to the potential of complementary medicine. What a journey it has been exploring these two fascinating worlds. We've traversed the intriguing landscape of complementary medicine, a realm where ancient wisdom meets modern understanding. We've demystified its essence, unearthing its core principles such as the body's innate healing ability, the interconnection of body, mind, and spirit, and the importance of individualized treatment. We've discovered that complementary medicine is not about prescribing one-size-fits-all solutions, but rather about tailoring treatments that align with each individual's unique constitution and health needs. In parallel, we've delved into the world of traditional medicine, a universe grounded in scientific research and rigorous clinical trials. We've learned about its strength in diagnosing and treating diseases, its focus on alleviating symptoms, and its ability to provide quick relief. Yet, we've also acknowledged its limitations, including its tendency to overlook the root causes of ailments and its potential side effects. Most importantly, we've compared and contrasted these two worlds, recognizing that they are not mutually exclusive. Instead, they are two sides of the same coin, each with its strengths and weaknesses. We've seen real-life examples and case studies that demonstrate the power of combining traditional and complementary approaches. We've seen how integrating acupuncture with pain management, yoga with physical therapy, or herbal remedies with pharmaceuticals can enhance treatment outcomes and improve patient satisfaction. We've realized that the future of healthcare lies not in choosing one over the other, but in harmonizing these two worlds. It's about understanding that while traditional medicine excels in acute care and emergency situations, complementary medicine shines in preventing disease and promoting overall wellness. It's about embracing a holistic approach to healthcare, one that respects and utilizes the best of both worlds. So as we wrap up this journey, let's remember the key takeaway. Both traditional and complementary medicine have their place in modern healthcare. Each offers unique benefits, and together, they can provide a more comprehensive, balanced, and effective approach to health and wellness. As we embrace the future, a harmonious blend of traditional and complementary medicine might just be the key to a healthier tomorrow.